Once a patient has decided to have weight loss surgery, they become very focused on the operation itself. As a practitioner, we want to focus on your entire life that you're going to experience after weight loss surgery. And that life's going to be different than the life you lead today. The whole goal of weight loss surgery is for you to lose down to a weight that you're comfortable with, that you have the quality of life you like, and to change the relationship with food for better and more healthy eating. So what can you expect in the postoperative period? Immediately following surgery, there's about 6 weeks of a transition diet. For the first 2 weeks after surgery, you'll be on liquids alone. People find their experience of eating very different after they've had weight loss surgery. And people sometimes struggle to get enough liquids in during the day. Many of us are very used to going the whole day without really drinking anything and then drinking a whole bottle of water on our way home from work. You're just not going to be able to do it that way any longer. And so having that 2 weeks out of work where you're able to focus on you, drinking small amount of liquids throughout the day, getting very comfortable with your new anatomy is the right thing. We're going to plan to see you in the office at 2 weeks. And at that visit, we're going to advance your diet to soft foods. These foods are going to be things like chicken salad and very well-cooked broccoli and cauliflower, things you could mash with a fork, so that you're having a little more satisfaction with your food, a little bit more hunger control with the protein, but not solids that you might have trouble with. Again, it's a transition, learning more about yourself, learning more about how your body is going to react to food after weight loss surgery. At your 4-week visit with us, we're going to advance to a solid food diet. Again, a written instruction sheet will be provided. We'll review all the appropriate foods. And then by that point, the patient has lost 20 or 30 pounds and is feeling very good about their operation. We have a visit at 6 weeks, and that visit is with the dietitian. For the vast majority of people, the questions at this point are, what can I eat? What can I not eat? Why do I have certain sensations when I eat chicken, etc.? And so those are best handled by our dietitian. And so you'll have a visit with her. So these visits at 2, 4, and 6 weeks, they're not just all about diet. We're intending to make sure that you're having a successful result with your surgery. You're going to see a provider, have an examination. We, of course, are going to check your wounds and make sure that your questions are answered. At your 2-week visit, you will begin your vitamin therapy. With all the operations we perform, vitamin therapy is a requirement. You will get information regarding the vitamins at your pre-operative visit, and we're going to ask that you have those vitamins at home before you have your surgery, so that at your 2-week visit, you're able to begin taking them. The vitamins are the same for gastric sleeve and gastric bypass. There's a specific vitamin set for duodenal switch. After weight loss surgery, patients have lost significant weight early on, and they're excited to do new activities and go to the gym. We are also excited for you to go to the gym and do more activities, but it needs to be measured. For the first 2 weeks, getting around the house, going up and down stairs is going to be fine. If you want to walk outside, please do. But I don't want you to do any significant exercise until your 2-week visit. At that time, we're going to clear you to do light aerobic exercise. That could be walking or jogging on a treadmill, riding an exercise bike, or even swimming in the pool. At 4 weeks, the patient can begin to do light weightlifting, aerobics, or even golf. And at 6 weeks, there's no restriction on your level of activity. Often patients want to know, how much weight will I lose immediately following the operation? And that's very individualized. In broad strokes, the heavier you are before your operation, the more weight you're going to lose earlier on. But it is highly variable. And we see people that in the first 6 weeks will lose a lot of weight in the first 2 weeks and then not lose a lot of weight for 2 to 3 weeks afterwards. That largely has to do with your body's water content and how it's being redistributed. You can only lose a certain amount of fat per week. So extra weight tends to be other stuff like water. And so it's highly individualized. What I encourage patients to do is ask the question. If you're concerned, then we want to be concerned.